Well, hello, everybody. It's great to see you all here and on a beautiful sunny day at Children's National right here in Washington, D.C. And not only are you here, but we have a lot of families and kids up there who are getting their care. It's an honor to host Vice President Harris and the Surgeon General, Dr. Murthy, here today. It's just been so thrilling to have them here and have them spotlighting these issues that are so important to us. The mental health of people like yourselves, doctors, nurses, pharmacists, respiratory therapists, environmental services, social workers, food service workers. I could go on, and you all know who you are, that have worked so hard, not only through this pandemic, but before the pandemic and even now. And we see the toll that it's taken of all the contributions that you've made, how intense it's been to care for kids and families here in our community, but also to take care of your own families and your own needs and your own community. And it's really come together and created a lot of pressure. We've all been together through this over the last 2.5 years. There's a lot less uncertainty about the COVID virus and what we're dealing with. You remember back to when people were scared to leave their homes and that kind of thing. Now we've got vaccinations, we've got medicines, and we feel like we're moving forward. But there's a toll that's been left behind. And that challenge of dealing with the mental health impact, not only of ourselves, but the kids that we take care of, the families, the community we take care of. And I understand the feelings of people that feel burned out, tired. You've given it your all. And now we're asking you to continue to do more. And people are sick, they're out, they're not able to come to work sometimes. But people are stepping up, and it's just been amazing, I think, to see how people have stepped up and then even go beyond. I had the opportunity last week to meet with some people from the Department of Homeland Security, and our teams have stepped up to help the children of Afghanistan, for example, and do even more than we're doing. So there's just so many ways that I've seen that, and you guys know me. I've been around since 1984 at this hospital. 2 years of fellowship, and then just had an amazing career. I've seen the relations all through the hospital. It's been fun today to see people that I've worked with over the years. And many of you know the most important relationship for me was the fact that I met my wife, yes, Linda Talley. She precepted you in the NICU, the #1 NICU, I should say, in the country. And when I came back and got elevated, or not when I came back, but when I got elevated to being the CEO at Children's National, I wanted to put a stamp of clinical on this hospital. Doctors, nurses, respiratory therapists, social workers running the hospital, and that the business would support that. And that's what we've done. Kathy Gorman, our Chief Operating Officer, is a nurse. Our general counsel is a nurse. And just on down the line, chief medical officers, David Wessel. So we can't lose sight of that connection, though, and that line understanding. And that's why I'm just so honored that the Vice President chose to come here with the Surgeon General to learn from our teams. What's going on the front lines? What can we do better? We've got some great examples. I see Dr. Sharma here, Dr. Corvo, Jitanli Prasad, who are leading our provider well-being, and thank you for that initiative. I know there are things out in the community where we're helping mothers before the babies are born to screen for depression and try and impact that before the babies are born to help them. So you've been focused on this issue that some people call burnout, and it is a feeling of burnout. But what we can all do, and I know the leaders here can do, is help find that joy, that excitement about what a career in medicine is all about. I feel it. I know you're on it. You've brought such enormous benefit to our organization, so thank you for your efforts. But we can't do this work alone. And that's why we're so glad to have partners in helping us do this. I think it's so meaningful that the Vice President of the United States has taken this issue on and shining a light on it and choosing to do that at Children's National. We love the fact that she's a graduate of Howard and one of our great partners, and to all the medical students and residents and doctors and nurses we work with at Howard. So we're pleased to have the Vice President Harris here and the Surgeon General Murthy focusing on this critical issue. So thank you all for being here. You're why we're here today. Thank you for what you're doing to help us better understand the experiences of healthcare workers and communicating that to the Vice President and the Surgeon General and to support them in their work. Thank you.
Please welcome psychiatrist and digital influencer, Dr. Sasha Hamdani.
Hi guys. My name's Dr. Sasha Hamdani, and I'm deeply, deeply honored to be here. I actually did a residency interview here, and you guys have a great cafeteria. So I'm a psychiatrist. I see kids from 6 and up. As a fellow healthcare worker, I can tell you the last couple of years have been exhausting. We have witnessed inexplicable loss. We have sacrificed time away from our families and our loved ones, and we've put our own physical and mental health on the back burner, and 10 times out of 10, we would do it again. I think we have been so focused on this COVID crisis that we've collectively ignored the crisis that's facing healthcare workers. We really just need to take care of those who take care of others. Neurobiologically, your brain changes when you're that deep in compassion fatigue. Mentally, you feel fatigued. Physically, you feel slowed down. You may start to isolate. You may start to feel GI symptoms, headaches, and then you may start to compensate with just self-medication or destructive behaviors because you want that temporary release. And that's not how you continue to take care of yourself if you want to keep serving others and serving yourselves. I first became vocal about this on social media, where I talked about how helpless I felt. That I felt like all I wanted to do was help, but my vessel was empty and I couldn't contribute in the way I should. The amount of response was colossal. I felt like people were reaching out to me and telling me their stories of compassion and commiserating with the experience I had, because it was what we were all feeling. Our helpers need help. If you are struggling, if you feel burnt out, seek those resources out, utilize and use your voice and tell people how you feel. The problem that we're facing isn't going to go away, but through awareness, we can shift the focus from self-sacrifice to self-preservation. I just want to thank the White House and the Vice President for not only taking action on this issue, but bringing it to the forefront so that there's less stigma around it. I think that really sends a powerful message that it's okay to ask for help. Take care of yourselves.
Please welcome U.S. Surgeon General, Vice Admiral Vivek Murthy.
Wonderful. Good afternoon, everyone. And thank you, Dr. Hamdani, for that kind introduction, for being such a strong, authentic voice on the subject of mental health. I also want to thank Vice President Harris for being here today with us and for being a tireless champion on the issue of mental health. It's been a privilege to work with the Vice President and the President on this broader issue, I know it's so important to all of us, and of course to millions of Americans. I also want to thank Dr. Newman and Children's National for hosting us today, and my gratitude to Nurse Monique Cawley and all of the doctors and nurses and technicians and staff that I had the pleasure of meeting earlier this afternoon. I would just say also on a personal note that Children's Hospital is a very special place in my heart. This is a hospital that I've relied on for care for my children. When my daughter was 1 year old and one day I noticed she was unable to put her weight on one of her legs, we rushed her to Children's Hospital to get care in the emergency room, where they found that she had an abscess or a collection of bacteria in her leg and required emergency surgery. As parents, we were extraordinarily scared. We were terrified, but it was because of the people here at this hospital and the compassion and skilled care they provided that our daughter did well, and she's thriving today. So thank you again to the people at Children's Hospital. Today, what you have been hearing firsthand already, and what I have heard from countless doctors across the country and health workers, including nurses, pharmacists, physical therapists, respiratory therapists, and public health workers, is that people are really struggling. And that after 2 years of COVID-19, and after more than 1 million precious lives lost, the people that we all turn to keep us safe, to comfort us, and to help us heal, they have been pushed to their limits. When I've asked health workers across the country to describe for me how they're feeling, they use words like burned out, traumatized, exhausted, helpless, and heartbroken. They still feel called to help and heal, no doubt. But they also confess that they don't see how the health workforce can continue like this. Something has to change, they say. And they are right. Even before the pandemic, more than half of nurses and physicians, including trainees, reported feeling burned out. COVID has made things much worse for them. And now more than 50% of public health workers also say they are reporting at least one mental health condition, like anxiety, depression, or PTSD. Now, the stakes are incredibly high. If we fail to act to address health worker burnout, we will place our nation's health at increasing risk. Already 1 in 5 physicians and 2 in 5 nurses say they intend to leave their practice altogether. Those are extraordinary and disturbing numbers. Now, this will affect the public's ability to get routine preventive care, emergency care, as well as medical procedures. And it will make us harder for our nation to ensure that we are prepared for the next public health emergency. Health disparities in such a setting will worsen as care becomes more scarce. And we will send a message to millions of health workers that their suffering does not matter. That's why today I am issuing a Surgeon General's advisory on addressing health worker burnout in order to call our nation to attention and to action to address this threat to our collective health and well-being. The advisory provides recommendations for healthcare organizations, health insurers, health technology companies, policymakers, academic institutions, researchers, and communities. And it includes recommendations like protecting the health and safety of our workers more effectively, ensuring they have access to health insurance, mental health care, and sick leave, not penalizing them when they actually do seek out mental health care, ensuring adequate staffing that's representative of the communities that we are serving, and reducing administrative burdens so health workers have time for what matters, which is their patients, their coworkers, communities, and families. This advisory builds on investments that the Biden-Harris administration has made and calls for a broader, sustained change that's needed across our country. Today's Surgeon General advisory is also a message to millions of health workers themselves, that their service and their suffering have not gone unnoticed, that we do not take their dedication for granted, that their health, safety, and well-being is as much a priority for us as the well-being of the people in their care. In this moment of need, we are committing to being there for those who have always been there for us. Addressing health worker burnout is also about more than just health. It's about reflecting the deeper values that we aspire to as a society, values that guide us to look out for one another, and to support those who are doing the same. Health workers have had our backs during the most difficult moments of this pandemic. It's time for us to have theirs. With that, let me introduce one of the many extraordinary health workers here at Children's National, Nurse Monique Cawley.
Hello, everyone. Hi, nice to... The last couple of years for healthcare professionals has truly been a trial. We as nurses have found strength in various places. I have watched my coworkers work around the clock, skipping lunches to care for unstable children. I've seen my coworkers cry and laugh together. Through the pandemic and currently now, we continue to keep each other afloat through laughter, hugs, and small talk. Mental health plays a vital role in nursing. I'm glad that our Vice President, Kamala Harris, also views the importance of mental health and is here to bring more awareness of it. Throughout her career, Vice President Harris has made improving mental health and well-being a top priority. And now she is making it a top priority at the White House. It is with my honor I present to you Vice President Kamala Harris.
Good afternoon, everyone. Good afternoon. Monique and I were talking backstage, and I was asking her about her work, and she said, I can't imagine doing anything else. In the midst of all that all of you do every day and what you endure, and I asked you the same thing, would you do anything else? You haven't quit yet. And it's because I know you're not the quitting type at all. And I do truly believe that the work that all of you do is an extraordinary gift that you have and that you give. And so it was very important to me and to the President that we would be here today to say thank you to all of you. Thank you. And Monique, thank you for sharing your story and for the 16 years of dedicated service you have provided. So before I begin talking a bit more about the issue of the importance of mental health, I do want to start by providing an update about the infant formula shortage. The first military plane landed yesterday with more than 70,000 pounds of specialty formula, and the second will arrive later this week. I know this is a scary situation for our parents and the caregivers who are taking care of these babies. Our administration is working around the clock to ensure that there is enough safe baby formula available for all who need it, and it is truly one of our highest priorities. So today, and collectively, I know, one of our highest priorities. We're here today to talk about improving the mental health care and wellness of healthcare workers. And it is my honor to be here, of course, with our Surgeon General, Vivek Murthy. Dr. Murthy, I will say that you have done extraordinary work over your career, and in particular, you have been tireless in the fight against COVID-19. And you have been, and I have witnessed it since the first days of our administration, a trusted voice throughout the pandemic. So on behalf of our nation, thank you, Dr. Murthy. Thank you. And I'm also very proud to be here with the folks who make Children's National the outstanding facility it is, the doctors, the nurses, the healthcare aides, the hospital staff and support staff, all of you who have chosen to live a life that is a life of service, and in particular, a life that is about our children and healing them, protecting them, and caring for them in the way that you do, in the way that I know is very personal. And I will tell you, I most of my career, in fact, all of my career, children have been one of my main areas of focus. What we can do to protect them, to keep them safe, to protect their well-being, and to nurture them in all the ways we know we have a responsibility as a society to do. You know, when we talk about our children, I know for this group, we all believe that when we talk about the children of the community, they are children of the community. And in that way, we should all feel a direct sense of responsibility for their well-being. When I was a young prosecutor many years ago, I saw firsthand how adverse childhood experiences can have a lasting effect on mental health. And for decades, I have fought to improve children's health and well-being. As District Attorney of San Francisco, I helped launch the Center for Youth Wellness to support children who were dealing with the effects of trauma. And as Attorney General of California, I launched a new bureau of the California Department of Justice that I named the Bureau of Children's Justice to protect children from the types of trauma that can have lifelong effect. I believe that the work that you all do to help the children and families of this community and of our country is truly remarkable work. For many of the people who come through the doors of this hospital, they spend time here that is probably one of the most difficult times in their lives. And as doctors, as nurses, as staff, you provide life-saving medical care, and you also offer comfort at a time when it is most needed. Your compassion, I truly believe, is light in the midst of darkness often. And you do so much to take care of your patients in their time of need. Which is why I'm here to say we need to do a better job of taking care of you. The COVID-19 pandemic has, of course, brought increased attention to the mental health of workers in our healthcare system. And we have asked so much of you over the course of these last 2+ years. Some of you held the hands of those who were dying on behalf of their loved ones. All of you worked around the clock, long before we understood how COVID-19 spread or what it did to the body. And before you were even vaccinated or had protective equipment, the kind you needed, you were still here doing this work around the clock. You spent hour after hour, many in a windowless room, unable to speak about how you were feeling, or only being able to speak with a small group who truly could understand what you were going through. But you did it nonetheless. So there is an urgent need that we have, I believe, to address all of this, and to address, of course, what has resulted, the stress, the burnout, the mental health challenges that you experienced most recently because of the pandemic. Yet, I will also say, and we know, the problem existed, this burnout issue existed even before the pandemic. And I'd like to recognize and thank the unions who are here, who have long been a leading voice on this issue. And you know, the term burnout was originally coined in the 1970s by a psychologist to describe the mental repercussions he experienced while working in a clinic. The choice to dedicate your life to helping people is a noble one, but too often it requires that you sacrifice so much of yourself. In 2019, more than half of all healthcare workers reported feeling burnt out. And that was, again, that was before the pandemic. Each of you made enormous sacrifices to save lives under impossible conditions, which is why President Joe Biden and I are fighting to transform how mental health is understood, perceived, and treated for all Americans, and in particular for our health workers. You deserve access to the mental health care that you need. You deserve support and understanding when you are struggling. And you deserve working conditions that support your mental health. That is why our administration has invested more than $100 million to expand mental health resources, including funding for healthcare organizations to create evidence-based programs around mental health and well-being for their employees. In addition, we have dedicated $200 million to train the next generation of community health workers, including workers who specialize in mental health care and are also a trusted voice in their communities. And today, Dr. Murthy released a new Surgeon General's advisory to address health worker burnout. It will include practical guidance about how to make workplace conditions safer. And it will recommend eliminating policies that punish people who seek help for mental health or addiction. I urge hospital systems and administrators to follow the Surgeon General's advisory. You know, the bottom line is this. On this issue of mental health, you know, one way to think of it is this. If you knew someone who broke their arm, you would help them. You would make sure they went to the hospital to get a cast. And after they came home, well, on their way home, you probably opened the door for them. You'd help them when they got home to get the support they need to heal through the point that they are feeling pain and then just need to heal. We have to do the same when it comes to mental health. I think for too long our system has failed to understand the significance of this. I think for too long when we think about health care, we act as though the body just starts from the neck down. Instead of understanding, we also need to address health care from the neck up. Mental health. So if you are struggling, please know you are not alone, that you are seen, and that you deserve to receive the help you desire and the help you need. The President and I are fighting to expand mental health care for all Americans because everyone should have access to the support they need to thrive. So with that, I thank you all again, each one of you, for the work you do. You are the angels walking among us. Thank you.